Hi there, my name is Alison. I'm here to give you a quick introduction to UDoTest, a disease prevention and risk mitigation platform that uses at-home disease screening. We think it's pretty compelling in the United States because cancer is one of the top 3 medical expenses for employers. Not only that, but the screening rates are quite poor, between 63 and 82% screening rates for both colon cancer and cervical cancer, and then there's still high annual cases per 100,000 for both these types of cancers. So our platform can essentially help lower the costs associated to it and the risks while increasing access and quality. Colon cancer, the second leading cancer killer in the US, in 2014, amounting to just over 100,000 men and women still being diagnosed. Cervical cancer, just over 4,000 women dying from it across the country. And STDs, as recent as 2016, there are still 2 million cases of STDs across the country, with enormous costs associated to that. From a cost perspective, the monthly and median cost of cancer drugs for an employer amounting to an average of between $13,000 and $14,000 per cancer case per month. And then as far as mortality goes, there's obviously a higher case of mortality reported in your South Central counties across the US, but still amounting to a level of between 294 to 504 per 100,000. As far as rural cancer death rates go, the percentage of excess deaths for leading causes of deaths, and that being cancer, in your non-metro counties as high as 24.2%, and then in your metro counties, 13.5% preventable deaths. There's some of the struggles in your rural cancer care areas across the United States reminds us quite a lot of other countries that we've operated in. But as you can imagine, struggles pertaining to limited cancer treatments and support providers, transportation barriers, financial issues, lack of availability of in-home services, oncologists and other providers actually being available in these areas. From a screening perspective, the rates are still below Healthy People 2020 targets when it comes to your pap smear, HPV test, mammogram, and your colorectal cancer screening test. So, what can an employer do to increase compliance and cut costs associated, as well as protect their employees from disease and even death? Introducing our disease prevention and risk mitigation platform that uses at-home disease screening. We currently have at-home prevention bundles for colon cancer, STDs, and HPV or cervical cancer. Our platform was designed for the employee to improve outcomes for the employer. It's affordable, discreet, safe, and convenient. So it's affordable in that it's an alternative to more expensive testing. There's no doctor's consult needed to access our platform. It's discreet in that there's HIPAA compliancy. It's made to be done in the comfort of your employee's home, private and confidentially. It's safe. Everything we offer is non-invasive, comfortable, with easy specimen gathering and easy to understand directions. And then it's convenient. So with our easy online ordering process available to your employees, they can access prevention 24/7. Then there's no time off work, no preparation, no doctor's appointment, no prescription or dietary change in order to do one of our prevention bundles. How our easy online ordering process can work for your employees: they can order directly on our platform. We deliver it to them in the home. The employee collects their sample and drops it off at FedEx. They then get feedback and support and referrals and assistance as soon as they have completed the process. So it's a win-win for an employee because they've got 24/7 access to our ordering online consumer platform and process. There's no time off work. It's private and confidential. There is support and referrals and care needed if need be. It's a win-win for the employer, so we're increasing screening compliance. So this is an option to close that 15 to 30% gap in cancer screening by offering our easy online ordering platform. We're tracking participation, and in our experience in other countries so far, we see a 66% preference to at-home colon screening, and then an 86% acceptance to at-home HPV screening. We're improving your employee wellness experience by having our friendly and convenient platform available to them. We're lowering costs and disease burden by detecting disease early and by ultimately reducing the necessity for more expensive interventions. It's also a win-win for the employer because we have an attractive billing model, so a pay-per-use as well as a shared risk model that is available to an employer should they wish, and access to our risk status and care coordination platform, where an employer can gain total visibility into the risk of their workforce in conjunction to the physician, the provider, the health plan that will ultimately expedite care and action and lower those costs. So our definitive risk dashboard shows population-based disease risk, participation, disease burden, cost savings, guidelines, cost avoidance, etc. A quick indication of what our prevention platform looks like now. So our system is pretty sophisticated and it's integrated into providers, insurers, employers, and their EAP service providers and programs, as well as our point of purchase platform. So our online ordering platform for your employees. And in the middle, we're tracking all the participation, the risk data, the disease burden, cost savings, etc. Here's a quick snapshot of what our dashboard can look like for an employer, tracking that engagement and that risk. And our platform itself is easy to launch. So an employer can identify their at-risk population or disease area. They can share basic information with us. The employee can enroll at a flat fee per prevention bundle per year. We then launch the service, announce it to your employees. We then can amplify the communication that goes out to the targeted population. We then track responses and uptake and reiterate the process if need be. And on an ongoing basis, the employer has access to their definitive risk dashboard. We're measuring the results, improving the outcomes, and ultimately improving the performance. In terms of client satisfaction and positive outcomes, we've received some amazing feedback from employers that we've worked with in the past, so much so that we saved one of their directors' lives and managed to get them expedited care quickly. And then an increase in compliance, so between 66 and 86% prefer at-home screening, and then a reduction in disease burden, being 8.5% early detection in the colon cancer space. We have engaging communication that can accelerate high participation amongst your workforce. And then we also have a quality and adherence service that we offer for employees who don't want to enroll and who don't want to get access to prevention and compliance, that we've really thought through in a lot of detail to increase that activation and engagement. We believe we've got a unique approach to prevention because we're removing the stigma, we're promoting holistic well-being. It applies across all cultures and in all geographies. And we're working with some incredible advisors, so from America's Health Insurance Plans to data scientists to ex-retail and Walmart to incredible doctors, to name a few. And to close, essentially, we believe that our platform is designed for the employee to target high-cost, high-risk diseases in your workforce. We've won amazing awards and recognition from really incredible brands and companies, from Genentech, Fruit Frost & Sullivan to AHIP, and we're working with Quest Diagnostics. And we believe that our disease prevention and risk mitigation platform that uses at-home disease screening can significantly help your workforces and increase that compliance and lower those costs. Thank you.